Welcome. You are listening to IJD In Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editors' highlights and a summary of our open access publications available to everyone.
May's editors' highlights delve into Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN, which are among the most severe skin reactions and require complex management. However, current prognostic models have limitations that underscore the need for personalized care. This issue of the journal presents a thorough synthesis of predictors for mortality and the complications related to infections in SJS and TEN. Additionally, we explore the psychological effects and surgical management of hidradenitis suppurativa, along with how educational interventions can help reduce regulated medical waste. These studies demonstrate dermatology's increasing integration with mental health, surgical innovation, and environmental responsibility, reinforcing a commitment to comprehensive, patient-centered care.
In our review section, an open access contribution by Desai et al. Sheds light on premature hair graying. This phenomenon involves the early loss of natural hair color, influenced by genetic, biological, and environmental factors. The review discusses the significant psychological impacts of premature hair graying and explores its underlying mechanisms, related health conditions, and available treatments. The paper examines the roles of genetics, oxidative stress, and lifestyle factors such as smoking and diet in premature graying.
First among our open access original articles this month is a study conducted by Sabolch et al. The utilization of PD-1 and CTLA-4 inhibitors has revolutionized the treatment of malignant melanoma. However, resistance to targeted and immune checkpoint-based therapies still poses a significant problem. The authors mine large-scale melanoma proteogenomic data to identify druggable targets and forecast treatment efficacy and resistance. Leveraging protein profiles from established melanoma subtypes and molecular structures of 82 cancer treatment drugs, the authors identified 9 candidate hub proteins across 5 distinct malignant melanoma subtypes. These proteins are potential drug targets applicable to one or multiple malignant melanoma subtypes. Additionally, by integrating proteogenomic profiles obtained from malignant melanoma subtypes with cell line dependency and drug sensitivity data, they identified a total of 162 potentially targetable genes. Lastly, they identified 20 compounds exhibiting potential drug impact in at least one melanoma subtype. Employing these unbiased approaches, they uncovered compounds targeting ferroptosis, demonstrating a striking 30-fold difference in sensitivity among different subtypes. Our results suggest innovative and novel therapeutic strategies by stratifying melanoma samples through proteomic profiling, offering a spectrum of novel therapeutic interventions and prospects for combination therapy.
Further, in this month's original articles, a study by Nicolau et al. Investigates and presents real-world treatment outcomes in patients with primary cutaneous B-cell lymphomas, or PCBCLs. These are rare cutaneous neoplasms with limited literature regarding treatment options and associated treatment outcomes. All patients with PCBCL who were treated in 5 major referral centers for cutaneous lymphoma in Greece over 10 years were retrospectively included with their baseline characteristics and treatment-associated outcomes collected and analyzed. In total, 235 PCBCL patients were included, of whom 53.2% were female. The median age at diagnosis was 60 years, and the median follow-up duration was 3 years. The most common subtype was primary cutaneous marginal zone lymphoma, 52.3%, followed by primary cutaneous follicle center lymphoma, 40.9%, and primary cutaneous large B-cell lymphoma, leg type with 6.8% cases. Complete responses were observed in 77.3% after first-line treatment. Both radiotherapy and surgical excision achieved superior outcomes, with 88.9% and 89% achieving complete response, respectively. Relapses occurred in 22.6% of initial complete responders. Radiotherapy and topical or intralesional steroids demonstrated longer time to the next treatment compared to surgical excision. Radiotherapy demonstrates significantly increased time to next treatment compared to surgical excision, suggesting radiotherapy as the preferable option. After careful evaluation, the authors consider that watch and wait may be a reasonable option for asymptomatic patients.
Another notable contribution by Silva et al., pertaining to an educational topic, presents research focusing on regulated medical waste. improving regulated medical waste, or RMW management is crucial for enhancing planetary health and cost savings. Here, the authors sought to assess an educational intervention on clinical staff understanding and behavior regarding RMW management. This 2-month controlled, prospective educational intervention at the University of Pennsylvania Health System surveyed healthcare workers, including physicians, nurses, and medical assistants, from 4 inpatient medicine floors and 2 dermatology clinics. Half of the medicine and dermatology settings were controls. The intervention included in-person staff training sessions and printed materials, such as posters, bin stickers describing waste segregation, and RMW's environmental health and cost impacts. A de-identified online survey, pre- and post-intervention measured RMW knowledge and behaviors. The primary outcome was a change in performance on survey questions on proper RMW disposal and RMW's negative externalities. Secondary outcomes were self-reported changes in environmental beliefs and waste stewardship motivators and behaviors, qualitative responses around stewardship barriers, and the impact of clinical role on intervention efficacy. Average baseline inpatient knowledge scores were 6.17 of 9 versus 7.51 for outpatient. The inpatient intervention increased the odds of answering each question correctly by 3-fold. The outpatient clinical role was associated with receptivity to the intervention. The intervention effect was 12.7 times stronger for nursing staff than for physicians. The intervention improved the overall understanding of RMW's negative environmental impact. An educational intervention can improve understanding of RMW's proper disposal and environmental impact, particularly among nursing staff, and inform future interventions.
In a surgically themed open-access short communication this month, Musi et al. Discussed the advantages of a combined treatment approach for hidradenitis suppurativa with tobacco pouch suture following carbon dioxide laser excision treatment. According to the authors, the integration of CO2 laser excision with the tobacco pouch suture technique proved highly effective in treating severe axillary HS. This method facilitated wound closure, reduced healing time, and minimized scarring, underscoring its value as a surgical option for complex HS cases. Further studies are warranted to validate this approach and establish standardized protocols for its application.
This was the May episode of IJD In Focus. Thank you for listening. Until next time.